Yeah, it's a good question. I mean, we definitely live in a moment when people have access to more information, quick and easy access to more information about their medical treatment and the products that are used in their medical treatment than they've ever had before. And so that could be a really good thing, it could be a bad thing, right? The downside is that people go online and all of a sudden everybody thinks they have cancer or whatever it is because it's so easy to go to WebMD and look at the symptoms and make a poor diagnosis of your own condition. The upshot is that you might have better informed consumers who are going to ask smarter questions of their doctors. Now, you could imagine, your question made me think of a scenario in the future where because of medical devices, because of robots that are doing providing medical services in a uniform way, effectively what really matters is the kind of decisions people make on the front end about where to go, but then the service is going to basically the same. If everyone's got the same robots or relatively similar robots performing, let's say, eye surgery, cataract surgery, it doesn't matter whether I go to hospital A or hospital B for that, but it might matter which product of implant I get, right? And so what really is going to inform that choice is having someone sit down with a counselor, is the decision on the front end about which hospital to go to, right? And so the key thing there might be to try to have someone sit down with a counselor and make an informed decision. And maybe the federal government, maybe the way to regulate in an effective way there is to have sources of information for people to compare the benefits and the risks associated with device A versus device B. So I agree with you. I mean, I worry about that scenario where we're talking about making trade-offs between different kinds of devices, but when you're in the emergency room, right? You may not even be conscious to make the decision, but even if you are, you're often just nod your head at the informed expert, the doctor, who's telling you, take this device. And I think we would have to think carefully about how to set up a system in which people can make informed decisions, especially ex ante before there's an emergency, about pre-selecting their options maybe, or having a sense of what the trade-offs are involved with device A versus device B. It's not clear to me that despite all of the things that we described as risks with medically connected devices, and I talked about the importance of giving people the option to not have a connected device, it is absolutely not clear to me that it's a better world, one where people don't have internet connected devices. I mean, pacemakers are not simple. It's not a simple procedure to put a pacemaker in. And if it turned out that the pacemaker was acting funny and you wanted to tweak it, my understanding is that there's quite a lot of calibration that happens in the beginning when people get pacemakers. If you gave me the option of having 5 dangerous surgeries or potentially risky surgeries where they're going to go in and fiddle with the device, or have a wireless device implanted once that can later be updated and calibrated, I think I'd opt for the wireless, despite all the risks that we're talking about, because in this case, the benefits are so outweigh the risks. We're talking about remote and hard to quantify and probably low likelihood risks. They will affect some people, and at the population level, they are real risks, but they are swamped, likely. We don't know for sure, but they are likely swamped by the benefits that come from having devices that can be controlled remotely for people who are in rural locations, or that can be adjusted over time without invasive procedures.